I needed to find something, an outlet to help deal with these emotions, because I love my patients and I really give them everything of myself. So I went to the trampoline park.
Hey everyone, welcome to another episode of HUMED, Human Medicine, where we unveil the human side of medicine. I am Dr. David Spiro. I'm a professor of pediatric emergency medicine at UAMS and Arkansas Children's Hospital. I'm incredibly delighted and honored to have Dr. Joana Mack with me today. And Dr. Mack grew up in California. In Southern California, went to UC Riverside, which is University of California, and Ross University for medical school. And then we were very fortunate enough to have her here as a resident in pediatrics at Arkansas Children's UAMS. And then Dr. Mack stayed on here in Arkansas for fellowship in pediatric hematology oncology, and now is in her 8th year of faculty practice with us. And we're incredibly delighted and honored to have you here on the HUMED show.
Oh, well, thank you for having me, David. I've watched your podcast and I've just been so amazed by the stories that I've heard on it. So I'm glad to be here.
And really the goal is to just unveil the human side of medicine. And we saw each other a few weeks ago, and I was really honored to hear that you wanted to be on the show, and you had a story that you wanted to share, and would love to hear a little bit about what you wanted to talk about. Yeah,
well, but then you told me don't prepare. So, I mean, I wanted to talk about something that's always been on my mind, just being in medicine. I feel like I've been called bossy all my life, just trying to get where I want to be in medicine, but just in life in general, and just hated being called bossy. And then I ended up having 5 little girls, no boys, all girls. And I thought, I will never call them bossy, because I think it's just leadership, right? I don't know. Have you ever been called bossy?
I have been, actually.
Oh, have you? Okay.
Yes, yeah.
Do you think you're bossy?
I try not to think of myself that way. It's like, it doesn't feel good to be called bossy.
Yeah.
Like when you've been called bossy, what does it feel like? Like what?
I feel like it is almost an insult when I'm called bossy. I try to be very kind to everybody in anything that I do. And so now, probably over the past 3 years, when somebody calls me bossy, I just say, no, I'm just a boss. So then now I feel like I'm bragging on myself, you know? But I've turned it into something that's more positive than being called bossy.
So, for the viewers to know, Dr. Mack does many things in academics. So in academics, we obviously take care of children, and in her field, she takes care of children with problems in their blood and oncologic problems. But also, she is an incredibly gifted teacher, and is a role model for teaching, and also a role model for research. She actually has a grant, a multi-million-dollar grant from the NIH around rare diseases.
That's correct.
And so there are different facets of your life. So just to take a step back, how do you balance all of that? Because in academics, we have multiple jobs, right? We're teachers, we're practicing medicine, we are performing research, we have administrative functions. Yeah. And then, so you have almost 4 jobs in one, and then you get home and you have 5 girls.
Yeah.
And one is still in diapers.
Yes, she is. I know we've talked about we can't get a dog until somebody's out of diapers.
Yes.
How do I balance it all? I really don't. We talk about this work-life balance. It really is more of I've heard this term work-life integration. I really do feel like work is life. And I think that's why I enjoy it so much. Am I tired? Yes, I feel like a lot of us are. But I truly enjoy every aspect of my life, whether it's at work or at home. Sometimes I'm a great mom and they have dinner on the table that I've made. Sometimes we're at McDonald's twice a week. They're all healthy. They're all thriving. Sometimes I forget to send that email at work, and sometimes I'm there till 7 o'clock every day. I don't know if that's truly balance in the regular sense of that word, but I guess I love it all, you know?
Well, it's a busy family because not only are you trying to balance all of that, your husband is also a physician.
That's correct.
And he's got his own life and his own career.
Yeah.
And you're coordinating that, and children at various ages, trying to get them to where they're supposed to be during the day. So it's just a lot of things going on.
Oh, it's crazy. My oldest plays volleyball. She's pretty good at it. My second oldest plays softball, and she's definitely daddy's little girl, and they spend a lot of time together. So I can't imagine what the other three girls are going to be doing and what our life is going to look like in 5 years. We're probably, if we feel like an Uber driver sometimes. It's fine though.
So I've had a few guests on the show, and we've talked a little bit about being present, like this concept of being present, just sort of very generalizable statement, and it's maybe overused. But the idea that we're being present right now with each other, and I'm learning, and our viewers are learning a little bit about who you are and what you do. How do you stay present with your family when you're at home, when you're on call and you have research due and you are trying to get those presentations viewed of your mentees to get to a conference?
Yeah.
How do you, and then you have a husband and being present with him and your relationship with him. How do you sort of stay present with your family?
It's extremely hard sometimes, especially when you have deadlines. I remember SSPR, so the Southern Society for Pediatric Research. You've been on that list a couple times, right? For whatever reason, 2 years in a row, I was on maternity leave when the abstracts were due. I was in bed until the deadline at 11 p.m. going through abstracts because I didn't have time earlier in the week to go through them to make sure every student was able to submit their abstract while I'm there with a newborn, a 2-week-old. There's some sacrifices that need to be made, you know, but then there are moments where, like this past weekend, we were at the pool having lunch and just playing, and sometimes we're at softball games and baseball games, and sometimes I need to bring up my laptop to do orders or to send those emails. It really is, it's challenging. And then sometimes you give more as a mom, or I give more as a mom to all my girls. Sometimes I give more to work, and then my marriage suffers in that. Sometimes my marriage is thriving, and then I don't give enough to myself. I think that's probably the thing that I, as a working mom, don't have enough time for, is myself.
But then we get back to the premise of maybe one of the reasons why we're here today is this thing that's been bothering you about being called bossy.
Yeah.
Who's called you bossy?
Everybody.
Really?
From my boss to my mom. I don't know, my daughter's probably even called me bossy from time to time. Just everybody. But, you know, thinking about today and talking about bossy, I've had a couple other things that have happened that I feel that just irks me in the when I'm at work. For example, I don't know if you've ever had this happen to you. There's an email from somebody and it says, Dr. Mack, Dr. Smith, and David. Has that ever happened to you?
Yeah.
Where everybody is doctor except for you?
Yeah.
That's good to know. I thought it only happened to women.
It has happened. Not often, but it has happened. Yeah.
That's one of the things that irks me, not because I want to be called doctor, but in an email, or in a situation, if you're calling everybody by their first name, or calling me by their first name, and then everybody needs to be called by their first name.
But is that a situation where everyone else is a man and you're a woman?
More often than not, that's what
Interesting.
happens. Yes. There's been a situation where the two female doctors on the email were both called by their first name, and everybody else was called, the male doctors were called doctor. But then I recently had a fellow, like a former fellow, I've discussed some of these things as they've become an attending recently. And he just stood there and listened to my story, and not about emails, but something else along those lines. And he said, but does that change the value that you have of yourself? Does that change the view that you have? Does that change your worth? No, it doesn't. It still irks me.
Yeah, but how do we, so it's an uncomfortable situation, because there's a point where you don't want to make someone feel uncomfortable, and maybe there's what we call unconscious bias happening, and it's not intentional, but it's still bias, and it still affects you in some way. I've written about my own unconscious bias around racism and taking care of Black families, and my own understanding of white privilege, because sometimes I find myself in a situation where I am very aware that I am for example, a white physician working with a Black family, and it's uncomfortable, and I think it's uncomfortable because of something that's going on that maybe I'm doing that's making everyone feel uncomfortable, and I don't ever want to do that. Right?
Yeah.
So I guess the question is, when you get an email like that, or you're in a situation where you're feeling like there is some version of sexism, is it your responsibility to actually say something? Because if you don't,
it just perpetuates.
It just continues.
Yeah. I in those situations, I've had somebody else respond, that's my friend, and say, "Thank you, Dr. Mack. I'll let Dr. So-and-so know," or something. But I've always wondered, why don't I just do that? And I've done it to people who are close to me and that are really in my circle and that are my friends, to say, hey, you did this, and I know you probably didn't mean to offend anybody, but in the future you may want to address it this way. But to people that I don't know and I don't work with all the time, I don't say anything.
Yeah.
I don't know what the right thing to do is. So. But
you're in a very unusual position, or we are in unusual positions, because it's not just like you're having a job doing X and you're experiencing this sense of sexism. You're actually a role model. And in fact, you're a role model in a field of pediatrics and pediatric oncology, and also in my field, in emergency medicine, where now the majority of the trainees are women.
Yeah. I mean...
And so people are looking at you and saying, how is Dr. Mack going to handle this? And is that true or not true?
It's very true, and you're absolutely right. I am, I have been seen as a role model, and I do have medical students and other trainees come to me to say, hey, this situation happened. And what I tell them is, listen, we're a human being first. I mean, it goes with, human and medicine, right? We are a human being first. Nobody should ever talk to you that way, and you should not let it go. I find a lot of students blame themselves for it. Oh, he or she, that attending was mean to me because I deserved it. I didn't know the answer to their question. No, we're human beings first, and everybody should be treated kindly, no matter what environment we're in. But then I go talk about these emails and don't correct people, I don't know. I feel like there's a line that I choose that is big enough for me to say something. And then other things, I just have to let it roll off my back, because number one, there's not enough time in the world to be angry at everybody,
Yeah.
Or angry about the small things.
Yeah, and I want you to know between us here today, I have no judgment. I mean, these are all questions that I'm curious about. I don't know where that line is, and I've experienced things around being Jewish at times, and I've experienced things that maybe is reverse sexism, or, you know, that I'm the boy in the room and things just don't seem right. I think that at some level, just even talking about it today is important. When you've been called bossy, is it mostly you're being called bossy by a man versus a woman?
Both.
Both.
I think it's pretty even.
Interesting.
I'm a pretty loud person. You know, like my favorite sport, I tell my daughters this all the time, is talking to people. That is my favorite sport. I love creating those relationships with people. You know, I basically grew up at Arkansas Children's, so I know a lot of the physicians and the nurses and just the staff. And so I feel like I'm just louder than a lot of people. And so some people may be more comfortable calling me bossy, and they may not mean anything by it, but I do think in general, to me, it has this kind of negative connotation to it, you know?
Yeah, it's interesting because I've always said that to me, the essence of healthcare is bidirectional communication, listening and articulating your thoughts and feelings. I'm very curious what your thoughts are around artificial intelligence and how that's going to affect the way that we communicate with each other and ourselves. I found myself, we now use various means to communicate. So we're communicating now. We communicated for you to get here today by text a little bit, and then by email. And then the younger generation, they're communicating through social media.
Right.
So how are you communicating with your residents? Like, how are you communicating with your fellows? Is it email? Is it text? Like and I found myself with artificial intelligence, when I'm writing a bigger email, don't tell Dr. Steinbach.
Yeah.
I'm kidding. But like if I'm writing a really important email, I will actually sometimes run it through a search engine, through AI to say, is this right? And I want to make sure that I'm getting across. It's almost like having another person vetting whether my email is not insensitive in some ways, and I'm articulating what I want to articulate. What's going to happen with artificial intelligence, and how is that going to integrate into how we communicate with folks?
So I'm going to tell you, I love AI. I think it has made my job much more efficient, especially seeing a lot of patients. I'm sure from an ER standpoint too.
Using ambient listening.
Yeah. And in that sense, I feel like it improves the communication that I have with patients, because I no longer have my back facing them, right? When I'm at the computer trying to type up a note, I am no longer thinking I have only a few minutes in this room because I have to go out and document, because now AI does it for me. So in that sense, I feel, and I actually have also seen physicians say, okay, this is your diagnosis, this is what we're going to do, and these are the prescriptions we're going to write, and this is the follow-up, because they want their note to be succinct or just like that, right? But from a communication standpoint with other colleagues and residents and the trainees, I think we are doing them a disservice when it comes to that. Because, I mean, I feel like we've probably talked about this a lot of times when they're consulting a specialist from the emergency room. They're just kind of cutting and pasting their whole note and putting it into Epic, instead of just putting their phone number and having a discussion. So they're losing that relationship that they could create with an attending or a fellow, and then also that teaching that we're missing. So we got to tread lightly.
Have you noticed, just on the subject of AI, have you noticed any patients using AI engines, or a suspicion of using AI engines in coming to you? Because you take care of some of the sickest children with cancer.
Yeah.
Is it being, because we've called them the Google parents, folks that would Google things and come in, but now there's artificial intelligence, which adds a whole other level of education or miseducation around what comes in. Have you noticed anything around that?
I definitely have. I actually appreciate it. I think when you can have an open discussion with parents, number one, they come in very educated about what their child has. So we start off on a different level of what their disease is and how to treat it. But then if you create that relationship with them, I think you and gain their trust, you can say, listen, these are the things, this is why that doesn't necessarily make sense and why you may want to stay away from this source, but this is a better source. I just think it opens up the discussion and helps create a better foundation for me and the patient family.
So we talked a little bit before about balance and, being present with your family and then just trying to figure it out. Is there something that you're working on right now that you're, from a personal standpoint that's addressing any of these challenges that you have in your life?
Great question. I don't know if I'm actively working on it. Could I have a therapist or a counselor? Probably. I'm sure it would help. I feel like there's not enough time in the day. But that definitely could help. But I have done something over the past year. I am a year and a half. I really have tried to prioritize certain things that I didn't prioritize before. So for example, my daughter is about to turn 14. I feel like I'm getting a little emotional about this. She's the oldest, and I have basically 5 more summers with her. Maybe 4, because her senior year summer, she probably is not going to want to hang out with me, right? So I really have 4 more summers with her. I have 4 more seasons of volleyball with her. This past year, she really came into a place where she got really good at volleyball and loved it. The year before, I only made 2 games during the weekday because we all work, right? So this past year, I said, I am going to make it to 80% of her games. And I did. I mean, it's a lot of games. I have probably 18 games that I made it to. Wow. It's pretty good, right?
That's great.
I may have made it to the last 2 minutes of the game. She didn't know that. I made it to the last moment where she touched the ball and then had to come out. She also didn't know that. Hopefully she didn't know that. But I made that a priority, right? Because I want to be present as a mom. I want to be present in those moments in life because I know I have 4 other girls and I'm probably going to still get those moments, but she's my first child. And so I don't want to miss that moment. And, I said earlier too, the thing that from a balance standpoint or work-life integration standpoint, the thing that I usually drop the ball on is time. Exactly. It's for me, right? How do I have time to regroup, to be a better mom, to be a better wife, to be a better teacher? And so this past year was the first time I went on an all-girls trip, just me and 2 of my best friends.
Awesome.
We've been planning it since I graduated from fellowship.
Wow.
We just could never go because me and my other friend
having kids.
We were having kids, exactly. So we didn't want to go travel. We were just having kids. I'd be pregnant and then she'd be pregnant. And so we just never got around to it. And we finally went. And, we go on trips for conferences and stuff, but it's different. You're still working, And we went and it was so rejuvenating to be able to have that time. And then before we left that trip, we planned our next trip, I don't know. Do you feel like that sometimes?
I think trips can be incredibly rejuvenating. I have a faculty member who was struggling on various issues and, in my field and in your field, the work can be really difficult.
Yeah.
Like we see some really difficult things. Sometimes we see the same things with kids who are dying of cancer, and then we see trauma and other things that are really unexpected. And I call in times that kind of trauma accumulates in us. I call it micro traumas that we experience as physicians, absorbing some of the hard things that we see. Children suffering on various levels, families suffering on various levels. And he took a trip for a couple weeks and went away. And I don't know what happened, but when this particular individual came back, this person was completely different. And I have found that travel always gives one a sense of reflection
Absolutely.
and perspective.
Right.
And especially if you have the privilege and ability to travel abroad.
Yeah.
I always find it. So I'll be a little vulnerable. I mean, I think that what I'm working on right now in my whole world of life balance is sleep, because I have had struggles with insomnia.
Yeah.
Because I don't do it now, but for most of my life, I've worked in the 24-hour cycle.
Right.
So randomly, I'd be working in overnight, and then 2 days later, I'm up at 6 a.m. doing another shift, and just circadian rhythm disruptions over decades have really affected me. And so I don't have insomnia anymore, but I still have some sleep disruption. But what I do have, which I think most Americans have, is an addiction to my phone.
Yeah.
And this podcast, viewers, I love you, but this podcast is, ongoing, and it's been a journey, and it's great, and but it does take a little bit of time just figuring it all out. And the phone is an easy way to just see who's coming online and how many subscribers I have and what are the metrics. And access to the phone is access to the world.
Right.
And now, of course, in our world, it's a way for people to get a hold of us medically.
Right.
So we use an EMR called Metric, and a medical record metric, Epic. And so we can be contacted 24/7.
Right.
So what I'm working on, so for years I always thought, well, I have to have my phone next to my bed because it's my alarm.
Right.
It's one of the hundreds of things thousands of things a phone can do. So the last month or two, I've really, probably every other night, I don't do it every night, but I really try to put my phone on a charger that's not next to my bed.
That's smart.
It's like in the bedroom, but it's away from me.
Yeah.
So I can't see it.
Yeah.
I can hear it, but I can't see it. And I track my sleep score with an Oura ring, and it's very clear. When I do not sleep with my cell phone, my sleep scores are better.
That's amazing. I can imagine.
And there is some like weird kind of juju kind of stuff. Unclear if there's any science by it, but the phone just being near your brain while you're sleeping may cause problems, let alone the fact that you know it's there.
Right. Yeah.
And it's the first thing you can reach for when you wake up.
I know.
And there is some science in the longevity world that in the first 20, 30 minutes of being awake, you're supposed to do deep breathing. You're supposed to go outside and look at the sun and maybe take a brief walk. But I have found myself for decades, literally decades, since cell phones have been available, that the first thing I do when I wake up is I
Get the phone.
check my phone.
Yeah.
What are my messages? What are my emails?
Yeah.
What's the data from the day before in the PZD? Because now it comes to me. What was left without being seen for the day?
Yeah.
And none of this, by the way, none of that, what I wake up with in the morning, and none of what I check at 10 or 11 o'clock at night is meaningful.
Right.
And if you actually hear Bill Gates and Bezos, the good and bad and what they've done in the world, people who have been wildly successful, they're not checking their phone all the time. And in fact, Christopher Nolan, who's a famous director who just directed The Odyssey that's out in the theaters, he doesn't have a cell phone. Now, he's probably wealthy enough that he has an assistant somebody.
Telling him what's going on.
Yeah, which we don't have the luxury of having, but he doesn't partake in emails and social media, but I'm sure he has someone around him that does, and he feels that allows him to be creative. So, I think that the way I see it is that I think it's great that we're all trying to work on something to better ourselves.
Yeah, absolutely. I will tell you, from a burnout standpoint, the thing right now that, in addition to going on those trips and putting myself first, but something that really rejuvenates me is really the students, the future of medicine, pouring into them, because you just don't know which student is going to be the one who truly finds a cure for whatever disease.
Yeah.
Do you ever see, I don't know if we can mention other people's names, but Dr. Todd Maxson, have you ever seen, is that okay? Can we mention?
Sure.
Have you ever heard of, he had a motorcycle accident several years ago.
I'm aware, yeah.
And he gave this amazing grand rounds. I've been trying to get him to do another grand rounds because a lot of people, there are a lot more new people now that haven't heard his talk or his journey through that life-changing event, and then also his journey through medicine, through the hospitals, and then recovery from that. He single-handedly changed the way I taught residents and medical students and fellows.
How?
So he gave this talk at Grand Rounds, and the day after that completely changed my outlook. I was a new attending. We had a lot of people on our service, a lot of patients on our service. I felt like I did not have enough time to teach medical students who may not be great at presenting or getting data. I almost felt like they were really preventing me from doing the job I needed to do to be able to take care of these patients in a timely manner, and then to be able to get home in a timely manner, right? And after his talk, he talked about a situation. He was, and I don't know if I'm going to get it right, so sorry, Dr. Maxson, but he was in the emergency room at UAMS, and he...
After his accident.
After his accident. He was laying on the bed. He knew he had internal bleeding. He had several broken bones. There was a picture that he showed in his grand rounds about his blood pressure, like snapshots of time, like his blood pressure going down, and he knew that things were probably about to get worse. But there was a moment that he said he looked up. The emergency room attending, the resident, the trauma surgeon, the general surgeon, the orthopedic, like everybody in that room, he said he knew he was going to be in good hands because he trained every single one of them. He knew he was going to live because he trained every one of them.
Wow.
And so after that talk, I thought, could I say the same thing? If I were in an accident, or if my kids were in an accident, could I say the same thing? That medical student or that resident or that fellow that had come through the rotation with me, did I do everything to teach them what they needed to know from a bedside manner, from somebody who was bleeding, from somebody being diagnosed with cancer? Did I teach them everything that they could know in order to treat my child, or to treat me, or to treat anybody? And the answer was no. I didn't invest in them. And from that moment on, it just changed. So everybody that I encounter, every resident, every medical student, how can I teach you to know that one day you may be my doctor, or also the next patient may need you, and I need to be able to teach you the things that I need you to know to save their life.
Yeah.
So powerful. Dr. Maxson, amazing physician and trauma surgeon. But that one talk changed the way I looked at trainees, and really changed the way what my career looks like now, So.
Yeah, I think it's probably, I spent time, I came out here from Oregon, but I went into the startup world and was out of academics. And, probably the main reason why I'm here today in Little Rock talking with you, and also at Arkansas Children's and UAMS, is because I want to spend the next decade or so training folks, because I feel like that is a privilege, and it's a gift, and it's to me the most exciting part of the work that we do is we get to shape this next generation of learners. And we don't have time to talk about it today, but it is going to be really interesting how artificial intelligence changes the calculus for all of that.
Yeah, I agree. And hopefully we will, we talked about this earlier too, that if we can meet in person, I want to meet in person, right? Instead of having, there's a time and place for Zoom calls, but the more we interact with trainees face to face, I think the less likely we're going to lose that, what makes medicine special, Well,
getting back to the premise of this talk with us today on HUMED, we've interacted a bunch of times. I've never thought of you as being a bossy person.
Well, that's good to know.
But the thing is that what I do see you as I see you as a strong, empowered woman who is an incredible role model for your daughters, for the next generation of pediatricians and oncologists that come into the world. And, I'm incredibly thankful that you're my colleague. And seriously, and I get to send kids who are really sick with fever and neutropenia to you. And, you can end up taking care of them and getting them better in the hospital. And, you're also doing this amazing work with research and trying to push the envelope so we can figure out how to take better care. It is incredible. Just 50 years ago, one of the Kennedy's kids died of leukemia because in the 60s and 70s, leukemia was a death sentence.
Right. Yeah.
And what is it now? 90%?
Yep. It's almost 90%.
Of kids with leukemia make it to 5 years and go into full remission.
Correct.
That is correct?
That is correct. Mm-hmm.
That's incredible.
Yeah.
That is incredible.
It really is.
To once a disease that was a death sentence.
Right.
Terminal.
Yeah.
It was a terminal disease. And there are some people who think, we were talking earlier, that glioblastoma, also a terminal illness, may be curable. There are thoughts about curing pancreatic cancer in adults with new biologics that was once unheard of.
Right.
So cancer may be, in general, something that we will think of like heart disease, that we just make a lot of progress around it. And maybe ways that we can prevent cancer.
Right. And David, I will tell you right now, I would be happy to be out of a job. I would be ecstatic to be out of a job for somebody to find cure for these kids with cancer. If you've ever seen a child battle cancer, you don't ever want to see that, but it changes your world. It changes your world.
Well, it changes my world when I witness it for the children that I usually see with fever and neutropenia that come in. That is when children come in who are immunosuppressed, or their immune system's not working well because they're getting treatment for cancer or they have really bad cancer, and they get fever and they can't fight it because they don't have the white blood cells to fight it. And that's when they're really exposed, and we have to do some things to help manage them, give them antibiotics. Before we go, while we're talking about all this, I've had a number of pediatric EM physicians come on the show because I'm a peds ER physician and I know a lot, and they've been on the show. This is the first time I've had the honor of having an oncologist.
Okay.
So my question to you is, when you do see something difficult at work, let's say it's a new diagnosis of cancer and it's a difficult conversation, or giving bad news, or you see a child pass away, how does Dr. Joana Mack deal with that?
You mean in that moment or after it happens?
How do you absorb and give yourself self-care in some ways around dealing with really bad situations, difficult situations?
I will tell you, in that moment, I really let the Lord lead me. I pray a lot. I pray a lot with my patients. There was a physician, Dr. Todd. I don't know if you ever met him. He was the critical care medical director. He was my mentor. And a long time ago, I wanted to be a critical care doctor, and I asked him for a letter of recommendation. He said no. He said, but I will write you one for pediatric oncology. He knew what my career was going to be before I knew it.
Wow.
But he prayed with patients in the ICU, and I always thought that that's not something you should do. The families welcomed it when he prayed with them. And so I have done that with my patients in if they have a new diagnosis or if at the end of life. And after that, after a difficult day like that, and actually even before that, you would know from an emergency room standpoint, these patients can come to the emergency room at 2 a.m. in the morning, and we want to be there to meet the families. I get on the phone with my mother-in-law, and I don't even have to say anything. It's 2 a.m. and she's a night owl, doesn't sleep, and she just prays with me.
Wow.
She knows that I'm headed to the emergency room. I don't even have to tell her, and she just prays that I have the right words for whatever family I'm about to see. And after difficult days like that, when I was a fellow, a social worker told me the way she got through difficult days was by giving herself permission to cry. So she would watch that movie, I can never remember the name, with Julia Roberts. I think she has diabetes. Is that, it's a flower, Magnolia, Steel Magnolia.
Steel Magnolia.
Right?
Yes.
I think that's the movie.
Yeah.
So she watches that movie knowing that she's going to cry because of the movie, but that's what gives herself permission to cry after a difficult day, after one of her patients have died. And so back in the day when I was a fellow, they said I needed to find something, an outlet to help deal with these emotions, because I love my patients and I really give them everything of myself. So I went to the trampoline park. That's what I did.
Wow.
I would take my 14-year-old daughter, but at that time she was 2 years old. I know the pediatricians in the audience are probably going to be like, why would you take her to a trampoline park? But we go to the trampoline park and we would just jump and jump and jump for hours.
Just to sort of
Release.
Yeah, interesting.
Yeah.
I had a profound experience a couple months ago after giving bad news, and there was a grandparent in the room. It was in a quiet room in the ER, and one of the grandparents was a minister. And I am Jewish, but I've experienced various Christian sects and denominations, and we're living in the South.
Yeah.
So you can't avoid it in terms of the culture. And he looked at me after I gave bad news, and there was some crying in the room. He said, would you pray with us? And I said, absolutely. And we went into a prayer circle, and there were some words said, and folks were crying, and I found myself very emotional. And it was one of the most beautiful human experiences that I have experienced, because I don't normally do that. And I spent most of my adult career in Oregon, where, frankly, in the culture in the Northwest, that might be, for some families, uncomfortable.
Yeah.
But for me, it was one of the most beautiful and profound experiences, because there was a sense that there was a power greater than us, which does exist, that we can rely upon during difficult times.
Right.
And it was just beautiful.
Yeah.
Yeah.
I will say there was, I have a lot of those moments because of my job, right? My career. I have fellows and medical students and residents with me all the time, and my fellows see me pray with my patients. I cry in the room too. I think it just creates this, I'm human, and I feel a lot of their pain. But I had a fellow probably about a year ago, he went into the room, was telling the family that they had leukemia, and then he prayed with them. And And I think that, you were talking about being a role model, right? And after hearing and seeing that fellow do that, we just walked to the next room, didn't really say anything about it. But I could see the emotions in his face. I could see the connection that he had made with the family. And in medicine, we have to bring the humanity in, right? They cannot just be another child with leukemia. They won't ever be another child with leukemia. They are a human being. Their families are just received this life-altering, shattering news that I just feel like no matter what, we just need to make sure that we treat everybody as if they were our own family.
That's the way I approach it. It's really interesting. I think reflecting on it, I remember in medical school, and I went to medical school 30 plus years ago, there was a sense that there was an objective, distanced from some of my mentors, like a distanced approach to families.
Yeah.
But through my training of pediatrics in particular, and let alone time, I feel that doesn't feel right to me anymore.
Right. Yeah.
And I feel like at one point in the trajectory of just generally medicine, it was very paternalistic, where I'm the doctor and I know. And I feel like now, and especially in pediatrics, there's more shared decision making, and also a blurring of this sense of distance where you can feel comfortable sharing a little bit of yourself as a physician, as a human being. Because I felt myself at times becoming quite emotional, and at times crying and feeling okay about it.
Yeah.
Whereas, I don't know, I think 40, 50 years ago,
probably
that maybe was not okay.
Yeah.
You know?
I will tell you, and I'm sure you probably feel this way too, David, like I could not do any of this job, this career, motherhood, being a physician and teaching the next generation of trainees, like could not do this without my in-laws, my parents, my children, my friends, my colleagues. It's just, it's a community. Yeah. You have to have this community, or you will be burned out in work and in life. There are just so many people who have helped me. You were talking about mentors. I think one of the first mentors I had was when I lived in Los Angeles. I worked at Cedars-Sinai. I was a front desk assistant, and there was this physician, an orthopedic spine surgeon, who would come through the front area to say hi to everybody, knew everybody's names. And I really modeled a lot of what I do now. I know our environmental services, our valet people, the nurses on our floor. I value those relationships because of
beautiful.
Of the example somebody set for me.
Yeah.
Or mentors that help you in your career and push you along, right? They are not just climbing, but they're pulling as they climb, right? And so that's what I do too. I want to pull people as they climb. Somebody said, what do you bring to the table? But it's also, we just want to build that table, to let people come to the table, right?
Yeah. Kendall Stanford, who who's like one of the most beautiful human beings, and retired now, but former peds ER physician, has taught me so many things in my 5 or 6 years here. But one of the things he taught me recently that I make a point of doing now every time I come, because the emergency department is continuous. It isn't like clinic doesn't start at 8 and leaves at 5. You're just constantly going, and people are coming at you with various things. But he said he always used to come to work a few minutes early and go around the emergency department and say hello to everyone. Cleaning staff, nurses, residents, everyone.
Yeah.
And I do that now. So I know who's there. They know I'm there.
Right.
They know that I appreciate them being there. I often say I appreciate you.
Yeah.
Because, and even the people that come in and, mop the floor and are helping out, even in the cafeteria when I go up, they're all part
Absolutely.
of the people that care for kids.
Absolutely.
They're all part of the team.
Yeah. Yeah.
So, it's great that you have that philosophy.
Yeah.
Well, I feel like I know you 10 times more than I did before this episode. We went from bossy to artificial intelligence to balance, and this was a great conversation.
Yeah, I had a great time.
We got to know Joana Mack.
Yeah. Thank you so much, David, for having me on. And like you said, we were in the parking lot or you were coming out of the garage. I was like, hey, I have a great idea for your podcast. Would you let me on it?
It all worked out.
Yeah. Thank you so much, David.
So for those of you that are watching, please hit subscribe. We're on YouTube, Spotify, Apple Podcasts, now on video with Apple, and follow us on Instagram, Facebook, wherever you get your podcast information. And I hope you all have a great day.
Thanks for listening to HUMED with David Spiro, MD. If you like this episode, make sure you're subscribed on Spotify, Apple, or your favorite podcast platform. The video versions are also available on YouTube. Make sure you subscribe and hit the bell there so that you never miss a future episode.